Mariam, you can start.
Okay. Assalamu alaikum, everyone. My name is Mariam Zahra. I'm a final year medical student. Um, so, we're starting a series of research sessions. Today, Dr. Amir Abbas will be speaking on how to start a research project. We'll formally begin this session with the recitation of Holy Quran. I would like Asghar to recite a few verses of Holy Quran.
الله الرحمن الرحيم أعوذ بالله من الشيطان الرجيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين صدق الله العلي العظيم.
The college, Peshawar. He has done his master's in epidemiology and biostatics from Aga Khan University. He was the faculty at Aga Khan University and currently is assistant professor of public health at Khyber professor of at Khyber Medical University. He's doing his master's in health data analytics and IT from Carnegie Mellon University. He has 15 publications to his credit. Without any further ado, I request Dr. Amir to start his presentation.
Hello, can you hear me?
Yes.
I think my internet was not well. So I apologize for that. And so I will start sharing my screen in a minute. Just give me a minute. Okay?
Okay.
Those of you who are watching this, Please comment whether you can see me clearly and you can hear me clearly. I will hide Mariam you from the screen so that I can continue the session. Okay. Okay. Very good. Uh, okay. Now I have the PowerPoint presentation as well. Can you people confirm to me in the comments that you can hear me, you can see me, and you can see the slides as well? I apologize for this delay because at times we are not fluent with the use of technology and it happens. So I'm just going to wait, or or I'm going to bring in Asghar uh, to. Asghar, can you hear me? Asghar, can you hear me? I'm not sure. Okay, okay, very good. All is okay. I got the comment. So now we're going to start the session. And once again, I apologize for this delay because of some technical issues. We will try our best. And this is because we are starting these sessions, the live sessions. So we will be maturing how we are going to organize them. Uh, so the session is about research question, how to start a research project, and important thing is I have to give you people some background how this works. As you people know that my name is Dr. Amir Abbas, and my introduction was given in the session. Uh, uh, I'm going to talk first of all. In the first part of the session, I'm going to talk about how the logistics of this session is going to work. I will be going through slides in the form of a lecture, and but the lecture is going to be divided into different chunks, and I will be pausing in between, and you people can comment in. If you have questions, you can comment in the comments. You can write your question in the comments, and as you can I will show you over here, like if somebody has a question, he can write and I can show it like this, and I can read it to everybody so that everybody can see the question. So therefore, I will request you people, when you're writing your question, write it as clear, as crisp as possible, so that everybody can benefit from that. That's one thing. So I'll be giving you the lecture. I will be dividing the lectures in different chunks, and in each chunk, I will see the comments and answer the question as I'm giving the lecture. That's one aspect of it. Having said that, that's going to be the logistics of it. And this session is going to be approximately 1 hour. If people are interested, we can go beyond 1 hour, but like I'm planning for 1 hour so that it's not very long as well. That's the second thing. The third thing is that we are going to jump directly to the session, which is research question, how to start a research project. Now, those of you who have been taking my sessions, this is something which they have been listening from me for quite a while. So it might be a repetition for them. But those of you who are listening to this session for the first time, or viewing this session for the first time, there may be a lot of new stuff for you people. So just for the sake of it, that why do we need this session? Whenever you are starting a research work or a research project, right? People start at different in different ways, and I will request you people who are watching this live. I want to keep it as interactive as possible. So the first, as I'm talking about this portion of the session, just in the comments, comment on the fact that whenever you start a research work, how do you start? Everybody starts differently, right? Some of the people will start. with the literature review. Some of you will start with making a questionnaire, or some of you may start differently. So I want to hear from you that how do you start. So but the right way to start a research project is to formulate a researchable research question, because uh, if you start from there, then all the subsequent steps will be very much easy for you. All the subsequent steps are linked to a well defined researchable research question. Uh, uh, with that, I'm going to go to my slides and I'm going to convert them, put it on full screen. When I'm talking about, I'm giving this session, there will be a lot of back and forth, and I apologize for this, because this is not a routine class format teaching session where I can see you people. So there'll be a lot of back and forth, and I'm moving back and forth before on different tabs, so that ensure that everything is aligned very clearly. Therefore, I apologize in advance for that. Okay. So yeah, I see one of the comment over here, and they say that they start with the literature search. Okay. And yeah, that's where people mostly start, and that is about right, but not exactly right. uh, so we are going to talk about this topic in detail, and I've gone through a lot of background. So this is going to be the objective of today's session. We are going to be talking about the scope of the research question. We are going to talk about the end user perspective of the research question. What is a depth model? Whenever you make a research question, people tell you that whether your research question is good or bad. There are two criteria to analyze the whether your question is good or not very good. One of them is finer criteria, and second is pico criteria. And if we have time, we'll be talking about the research question from the perspective of study design. But I'm anticipating that we will not get there because it's a lot of work, it's a lot of discussion. Therefore, we may leave that to the subsequent sessions. So, just I'm not a lot fond of definitions, but since we are talking about research, a textbook definition of research is here. Research is a systematic process of collecting, analyzing, and interpreting information in order to increase our understanding of a phenomenon about which we are interested or concerned. The definition of research is not very important, but what is important is a conceptual understanding of what research is. So, my subsequent question from you people would be to write in the comments, is those of you who are listening or watching this session live, is what do you think before understanding this, attending this session? Uh, what is research? I just want to hear from you people that what do you think? What is research? And in there are some comments. Uh, okay, I think there's a comment that I can. I've minimized it, and I will try to show the text from there. Thanks a lot for this feedback. Uh, so in the comments, please write what is research according to you people. And philosophically, I will explain it to you. Research is actually uh, the quest for truth, the journey to find out the truth. There is a truth in the universe the way it is in actuality, and we want to find that out. Okay. uh, yeah, so Muhammad Kamran is saying finding new knowledge. Okay. But the way I see it is research is uh, uh, so there is an absolute reality somewhere lying in the world, and we are trying to get as near as possible to that absolute reality, and that process is known as research. So that's why it's a relative process. You do research, and then do more research, and somebody else is saying searching again on the same topic. Okay, that's one aspect to look at it. And research is something, so research is something which fulfill your thirst of knowledge. So that's the process of acquiring knowledge. Okay, but what is knowledge and what is research? Research is something that there is an absolute truth which is lying somewhere, and you are trying to get as near to that absolute truth as possible. So that is perhaps the research from a philosophical perspective, from my understanding. But that is not. So I'm not going to spend a lot of time on that. It's not our topic. Our topic is to how to do a research and how to start a research, and specifically what is a research question. So from where a research question arises, again, uh, whenever we're talking about research work, from where does it arise? uh, what do you people think? uh, it arises from what we call as a problem. So you have a problem in the real world. Okay. uh, the problem may be in the field, it will be in the field in which we are practicing medicine. And as I'm talking about the problem, please write in the comments that which fields, or if you, there are doctors, which fields they are. If they are medical student, write medical student. So uh, so let's assume, I will give you the example of COVID-19 pandemic, because that's very much topical these days and there's a lot of discussion on this topic. So there are a lot of issues and there are a lot of problems related to COVID-19, whether uh, which type of treatment works, whether social distancing works or it doesn't work. What do we need to do in order to prevent COVID-19? Which type of vaccination works? So there's a problem in the real world. There's a high incidence of a new condition which is known as COVID-19 infection, and you want to prevent it. So what will you do? You will try to prevent that, and that problem is going to be giving rise to a number of research questions. A good research question will be which is connected to a real world problem. Okay. So that's where the research question arises. Something we talk about the scope of the research question. These are the terms, as if you are a medical student or you are a doctor, and as I can see, there are some medical students over here, some gastroenterologists, and a pharmacy student. So there's a diverse set of audience, or people who are listening or watching this session. So whenever you are talking about the scope of the research question, these are the terms which are on your screen: the incidence, prevalence, therapy, screening, diagnosis, prognosis, harm, etiology, prevention. I will not go into the details of these terms because they are self-explanatory, uh, but you need to be clear about the concepts of them. For example, when you're talking about incidence, you're talking about new diseases. Okay, when you're talking about prevalence, you're talking about all diseases. So similarly, therapy, screening. The important message from this slide is that these terms, when used in the stem of the research question, they specify the scope of the research question, that what are you going to do. Okay. And uh, I will pause here for a minute, and I will ask those of you who have any questions, please write your questions in. So far we have talked about things. If it is not clear, please write your questions in the comments, and I will pause, and rather than just being silent, I'm going to review what we just talked about. We talked about that a research question arises from a actual real world problem, and that problem may be in the will be in the field in which you are practicing. You may be a gastroenterologist, as Dr. Kamran is in the group. You may be a pharmacy student, you may be a medical student, or you may be any other. You may be belonging to any field of medical sciences. Uh, so a problem arises, and you have to convert that problem into a researchable research question. And these are the terms which talk about the scope of the research question. And most of you will be familiar about what these terms means. If you are not familiar with them, there are two ways. You can Google them, and I have a separate video which will be talking about the details of these terms in my YouTube channel. You can go through that video as well. And so I'm going to see if there is any question. Okay, so there's no question. We have intensivist with us as well. So I'm just going to give you an idea that who are our audience. A pharmacy student, we have pharmacy student, and we have medical students. and we have intensivist. So yeah, so we have a diverse, we have a gastroenterologist as well. So we have a diverse audience with us, and that's really interesting. The real value of this diversity will come if you people ask the question, and there is a question, and let me show it to you people on the screen. That Ziaur Rahman asks, "What contain in a good research question?" That's a very good question, actually, and that's exactly this. The whole of this session is about that. Uh, Whenever you make a question, so this is how it works. That you make a research question, and you take that research question to your supervisor, and most of the time, what happens that the person tells you that it is good or it is bad, but the reason is not told to you. Okay, so this is exactly what we will be talking about when we reach to the point of the finer and pico criteria. That point will answer this specific question. So hold on to this question, Zia. And if that is not answered at that point, then you can ask this question again. And okay, I will move ahead with the assumption that there are no questions, more questions at this point in time. And but if there are any questions on the fly, please leave them in the comments so that I can read them. And I'm going to be talking about the next part. So what you're seeing right now is a research cycle. Okay, so research process starts from a research question. Then you choose your study design. You choose a study proposal, protocol, or synopsis. These are the three terms which you use for them, and they're almost synonymous. When you use the word study protocol, proposal, synopsis, when you hear these terms, they are used in different contexts, but they imply the same thing. Then you execute the study. Obviously, in between, there should have been a term that you apply for ethical approval, you get the ethical approval, then you execute the study, you do the analysis of the study, then you interpret, you disseminate the result. And now the important point is that a good research question which arises from a problem will impact the guidelines in that very field. All, either it's directly impacting the guideline, or it is moving the literature a way forward in a direction so that the guidelines are modified. So this is the example. This is how the research process works. Subsequently, I'm going to talk about something which we call as the depth model. This is more relevant to the clinical research, and the depth model is very simple, but just important that when you're doing a research, in which category the research process is. Depth is an acronym. D stands for diagnostic research, E stands for etiological research, P stands for prognostic research, and TH stands for therapeutic research. And I do not need to explain it to you people. Everybody knows. And if some of you are very beginner, I would request you people that you should Google these things. They're very simple. But from a perspective of clinical research, your research comes into these four categories. But why this classification is important? This classification is important because uh, of the importance of two terms. And here is the point where things get a bit of tricky, and it becomes very quite not very easy to communicate this concept online. Um, there is a term which is known as associated factors, and there is a term which is known as causal factors. So, as I told you, that the depth model classifies the research process into diagnostic, etiological, prognostic, and therapeutic research. When you're talking about diagnostic and prognostic factor, we are looking for the associated factors. And when you're talking about etiological factors and therapeutic factors, we are looking for the causal factors. And before I go into the details of these uh, uh, factors, I will ask you people the question: what do you think? Do you people understand? Do you think that they are the same things when we talk about association, or when we use the word association or causation? Do you think that they're the same thing or they're different thing? Um, you have to, even if you do not write it in the comments, you have to ask yourself these questions, that they seem to be very much related, but why do we use them as separate words? Okay, and the important point at this junction is that these terms, when used in the stem of the research question, imply things which are completely separate from each other, though they sound deceptively similar. They are so similar that one may uh, de- get deceived that they are similar concepts, but actually they are different. They are quite different. Everybody is saying different. But if I ask you the question that, can you explain it to me, that what is the difference between the two? So some of you might be able to explain it to me, but uh, I will. I'm sure that majority of the people do not have the conceptual understanding of the difference between what is meant by association and what is meant by causation, and it is uh, taken off as similar things or in the context of research. Uh, but why it is important? It is important because when you use it in the stem of the research question, when you use association, then you imply something else. Your study design implications are separate, and you are going in one direction. When you imply, when you use the word causation or causal, then you are implying something else, and your direction in terms of study design is totally separate. So let me try to explain it very quickly. I will not be able to do it in depth, but and so there is a comment related to, yeah, this is quite near to. So Sakina is saying that for associated factors, we don't know about the cause and effect. This is quite near to what is the reality. And thanks, Sakina, uh, for for giving me the comments. If anybody else has any comment related to this, please leave them in the comment. Uh, But let me explain this to you, and let me try to explain it. When we're saying that there is an association between factors, and I will give you the example of a classical example which we use for smoking and lung cancer in the research methods teaching. When I say that there is an association between smoking and lung cancer, okay, what do I mean? So the classical expectation is that smoking leads to lung cancer, but that is one possibility. Okay, that is one possibility. When we use the word association between smoking and lung cancer, and I say there is an association between smoking and lung cancer, then one possibility is that smoking leads to lung cancer. But there is an alternative possibility as well, that somebody who has lung cancer, that person becomes hopeless and starts to smoke a lot, and start to engage in all of the unhealthy activities. One of that will include smoking. And so what would happen in that case? That increased in lung cancer leads to increase in smoking. So that the first one is known as causality, and the second one is known as reverse causality. So whenever there is an association between two factors, there are two possibilities: either smoking led to lung cancer, or the lung cancer led to smoking. So the first one is known as causality, and the second one is known as reverse causality. So whenever there is an association, there is either a causality or there is a reverse causality. But when we use the word causation, we are implying that the smoking preceded the occurrence of lung cancer, which means that first what happened, that there was people were lung cancer free, which means that people were disease free. They started to smoke, and then they got the lung cancer. So that's a very subtle difference which is needed to be understood. And I'm assuming that majority of you will not understand this concept. That is okay. We will revisit this concept multiple times in these sessions to ensure that each one of you get these concepts correct. But at this point in time, one thing to emphasize is, even if you do not understand the subtlety of this concept, you need to acknowledge the fact that these are two separate factors. One thing. Second is that when you use the word association in your research question, then there are different study design implications. And when you use the word causation, then there are separate study design implications. And there is a comment related to this from Muhammad Kamran: association can have confounders. Both can have confounders. Okay, it is not. I mean, the concept of difference between association and causation is not uh, uh, defined by confounders. So it's good that people talk about it so that I know that what you people are thinking. Confounding can be present when you are establishing a causal relationship as well as a non-causal relationship. So I will just go forward from this point in time because I think we have spent enough time, and now we have reached a point where we are about to answer this question, which was asked by Ziaur Rahman. That what contained in a good research question? That's a very good question. I actually like this question, and that's why I like interacting with you people on the fly when we're talking, because I tend to know that what are the problems, which are, what are the questions which are arising in your mind. I want to answer them. So from this point in time, I'm going to answer. My presentation is going to be the answer to this specific question, and so whensoever we comment on whether a research question is good or not a good research question, we have two criteria. We have two criteria. One is known as the finer criteria, and second is known as the PICO criteria. And we have to you have to screen the research question on these two criteria. Uh, the finer, I'm going to talk about the finer criteria first, and then I'm going to talk about the PICO criteria. Finer is an acronym that stands for F stands for feasible, I stands for interesting, N stands for novel, E stands for ethical, and R stands for relevant. So your question, research question is need to be feasible. When I mean, when I say feasible, when we say feasible, what do we mean by feasible? You need to have adequate number of subjects. Okay, you calculate the sample size, and you find out that your sample size, required sample size for your study is say 5,000 or something, or 4,000, but the disease is very, very rare. Okay, and you're not going to get that many subjects for your study. So is your study feasible or not? That's you need to explore. You need to have adequate technical expertise. For example, you want to do next generation sequencing of a particular condition in your society, and you do not have the technical expertise, the way to find out the genotype, and I mean, and none of the members of your team have this expertise. Either you recruit a person, include that person in your team to get this expertise, or you need to think of something else. You need to have affordable time and monetary resources in order to conduct a research project. I'm going to talk about it in a minute, and the research should be manageable. So all of these things are going to be context bound. For example, somebody is a medical student, another person is a resident, third person is a person working in government organizations. So the feasibility aspect is going to vary for each one of them. Okay, somebody who is a medical student, feasibility will be different for that person. uh, if you, for example, if you're doing a fourth year research project, you have a particular timeline for that, and you perhaps do not have any resources, no monetary resources, or very little monetary resources, uh, as opposed to a situation when you're working in a government organization, you have a lot of resources to your disposal. So these things will vary accordingly, and the feasibility will vary accordingly, and you have to decide that whether the study which you design and the research question which you are executing is feasible in your context or not. Then your research question is needed to be interesting. Now when we say interesting, I do not mean interesting as is a hype created by most of our media channels. It's not that type of interesting. But when I say interesting, interest by interesting, I mean that it should be interesting to the practitioners of that particular field. For example, if you're doing a research on hepatitis C, then that should be of interest to gastroenterologist or hepatologist. As a very important example is that of sofosbuvir. When it was not there, and when it came, it totally revolutionized the treatment of hepatitis C. So that was an interesting research, as opposed to a situation when you're doing a study where you are doing the same thing again and again, which will give you a publication but will not convince the practitioner of that particular field to change their practice to a lot. For example, if you are finding again and again finding the prevalence of depression and anxiety in different populations, perhaps the results are going to be almost similar, and the field is not going to be progressed a lot. Uh, The idea is needed to be novel, the research question is needed to be novel, and novelty can be determined by review of the literature. And the concept of novelty is needed to be understood as well. Novel can be something which is extremely technology intensive, that you can have a very complicated algorithm, or you can have a new device invented or something like that. But at the same time, it can be extremely simple, like ORS, which is considered to be the most impactful and most novel solution of the last century, which is extremely simple, but it solved a problem in a way of preventing the deaths of millions of children in a very simple way. So, I mean, novelty, when you're talking about novelty, it should be novel in your context to understand the problem and find a cost effective way to solve that problem. Again, your research is needed to be approved by an ethical review committee, and that is a topic by itself, which I'm not going to go into a lot of detail. The research is needed to be relevant to the population in which you are conducting the research project. For example, if you're conducting a research project in USA, tuberculosis might not be very relevant. So if you write a grant on pulmonary tuberculosis, the government is going to say that, okay, it's not our problem. But in Pakistan, almost a substantial proportion of the population is suffering from pulmonary tuberculosis, so that would be relevant. So I will pause and see for the comments and questions and see. And there is a new question or comment. Let me read that. So this is an interesting comment from Asad Mehdi. He's saying that association is a general term. There can be many kind of associations. An associative relation assures a correlation. Um, Causation is a more specific term. It explains the nature of association. Mehdi, not exactly like that. So now, as I was not going there, but if when since you have brought it up, so there are, I didn't want to increase the confusion, but there are three terms actually. One is correlation, one is association, and one is causation. And all three of them are very distinct epidemiological and statistical concepts. That's what you need to understand. And association is something, for the time being, what you need to understand and remember one thing, that if there is an association between two factors, say A and B, either A leads to B or B leads to A. But when we say that there is an exposure in and there is an outcome B, and there is a causal relationship between A and B, then no discussion. A leads to B. That's simple explanation of association and causation. So I will ask you people that if there, please tell me if there are any other questions. Write those questions for the concepts which we have covered so far, and I'm going to go back and revisit those concepts in the meanwhile, and I will come back to see if there are any questions. So if there are some questions on the concepts which we have discussed so far, we went through the definition of the research question. The textbook definition is not important for me, but the conceptual understanding of the research question is more important for me. We talked that there's a problem, and a research question comes from a real world problem. We talked about the scope of the research question, and these are the terms in the stem of the research question which are going to specify the scope of the research question. Then we talked about the research cycle, and these are the steps in the research cycle. And we said that good research is one which benefits the end user, and the end user is the person which is practicing that very field, that particular field. And we talked about the depth model, which is the diagnostic research, etiological research, prognostic research, and therapeutic research. We talked about the terms association and causation. We talked about the final criteria so far. And before I move further, I'm going to see if there are any other questions. Okay, so this is another question. Could you please share some good example of research question for better understanding? This is again a very good question. I'm going to, because this session is not going to be long. When I'm conducting this session in the real world, so this is what I do. I mean, when I'm in the form of a workshop, when I'm have a group of 20 students in front of me. So what I do, I give them this 30-minute talk and divide them into groups of three, and each one of them comes up with a question, and then we critique on them. So that's a very good learning exercise. I'm going to try to give you a couple of examples in this session, and the subsequent session is going to be on study designs, and these concepts will be applied more rigorously on those study design concepts. And I will request, some of the examples will come over here, but there will not be a lot of examples because we want to keep this session short. But in the subsequent session, which is on study design, we'll be taking these concepts forward with examples and connecting them with study designs. So I will request you to uh, attend the subsequent session to understand the gist of this, or at least if you're not able to attend it live, you can watch the recording of that session as well. There are a couple of other, uh, you're welcome, Mehdi. And there is this question. What could be handling of ethics of stringency towards ethics by the research in a time of emergency like this COVID pandemic? This is an excellent question by Sakina. Uh, so she's saying that we are in a situation where this pandemic, there is a need of research project, research work, but at the same time, there is going to be a lot of risks which are associated, and that is going to give right to a lot of ethical questions. I mean, to be honest, this is a question to which I exactly do not know. What I'm going to do, if you actually, if you want to uh, find answer, I mean, the answer is not in one sentence. That's for sure. There's a long answer to that. That's one thing. Second is that for getting answer on this particular topic, I'm going to interview the chair of randomized control trial unit at Aachen University, Professor Saeed Hamid, on Monday. I'm going to be recording that interview, and this is exactly on this topic. That, I mean, that's going to be talking about ethics, and that is going to be talking about a number of different challenges on research work during this particular COVID-19 pandemic. So I will request you people and those who are interested in getting answer to this question to watch the session, because Dr. Professor Saeed Hamid is a senior researcher. He's the director of clinical trial unit at Aachen University, and he is going to be talking on this exact topic in this session. So I'm assuming, since this was the last comment or question, I'm going to go forward to my slides and talk about the last criteria. And let me see how much time we have. We have just 15 minutes left. Okay, so the next criteria is on which we call as the PICO criteria. PICO is an objective criteria. So when I say, as I was Zia raised a very good question, that whenever we are talking about a research question, what makes a research question a good research question, what is not a good research question? Answer to that point is all of the things which we discussed, but specifically two things. One is the final criteria you have to screen the research question on, and the second is the PICO criteria. PICO, once again, is an acronym. It stands for population, intervention or exposure, comparison group, or outcome. Now, when we are talking about the PICO criteria, we use PICO in two ways. One is PICO, and one is PECO. When we use PEC, so for the sake of this discussion, I'm going to broadly classify the researches into observational and experimental studies. So when we're talking about an experimental studies, when there is an intervention, then we use the PICO in the form of PICO. And we use the observational studies, then we use PECO format. So what is PICO? PICO, P stands for population, I stands for intervention in the case of experimental studies, and exposure for the observational studies. C is comparison group, and O is the outcome. What does it mean? It means that whensoever you write the research question, and research question, as the name implies, it's a statement, it's a single liner. And in that one line question, these things, which is the population, the intervention or exposure, depending whether the research is an interventional or observational study, comparison group or outcome, that should be explicitly clear, which means that if I read that question, I should be able to pinpoint, okay, this is the population, this is the intervention or exposure, this is the comparison group, this is the outcome. and there should not be any ambiguity, and you should not require in majority of the cases to explain further details for the person to understand it. At some occasions, you might require some explanation, but most of the aspects would be explained with the help of uh, the PICO question statement. So when we're talking about population, what should be specific about the what should be known about the population? Uh, we need to know uh, uh, these things about the population. Whether you're talking about the diseased population or the normal population, we're talking about important characteristics of the population that includes age, gender, ethnicity, whether you're taking your sample from hospital, community, nursing home, etc. Uh, so these aspects are needed, are required to be clarified in the context of a population. Then exposure or intervention. As I told you, people, when I'm using the word intervention, I mean the experimental studies, and exposure, I mean the non-interventional study, which is the observational study. So when we're talking about these things, for example, intervention, what is the timing of intervention, dose, route of intervention, route of administration, and duration of therapy. When we're talking about exposure, for example, smoking and lung cancer, then uh, uh, what is, how do you define smoking? If somebody casually smokes a cigarette, is that person going to be called a smoker or not? And or like you have to have a specific definition of smoking, uh, and if that definition is not needed to be vague. And I'm going to move forward to the comparison group. So let me explain these things by explaining it in the context of once during the interventional studies, and second time for the non-interventional studies. Let's assume I'm talking about an interventional study where um, uh, the intervention is sofosbuvir, and we are talking about, so let me give you an example of a research question, that does sofosbuvir, giving sofosbuvir as compared to the routine treatment or standard treatment, induces sustained virological response in a patient of hepatitis, in among hepatitis C patients presenting to the outpatient department in Jinnah Teaching Hospital, Karachi. So in this case, I've been very specific about the population, which is the hepatitis C patients coming to the outpatient department of Jinnah Hospital, Karachi. Uh, as I told you, the intervention here is phosphorus, so I need to be clear about the exposure, not the exposure, the timing of the intervention, the dose of the intervention, the route of administration, and the duration of the therapy. Some of these details can be addressed in the stem of the research question, and others can be addressed in the research proposal. Then I can go further. The comparison group, as I told you, that I said that I'm comparing sofosbuvir versus standard treatment, but I can also compare it with placebo or no treatment. And the outcome, as I told you, that I'm using the word sustained virological response. So what I mean that I want to give sofosbuvir to hepatitis C patients, and I want to induce a sustained virological response, which in simple words means that a hepatitis C positive person will become a hepatitis C negative person. That is the outcome in the context of an interventional studies and applying the PICO criteria in the form of in an experimental study. In the same way, if I have a non-experimental study, taking the example of smoking and lung cancer, I will ask the question that is there an association between smoking and lung cancer in students of Karachi University at Karachi, Pakistan. So I've specified a population of students, university students of Karachi University. My exposure in this case is smoking, and I have to be, in the proposal, I have to be very much clear about what is the exposure, which is smoking, but what is the duration of smoking, what is the dose of the smoking, which I will call as an when I will classify a person as a smoker and non-smoker. And when I'm talking about the comparisons group, will be comparing smokers with non-smokers, and the outcome which I'm addressing over here is the lung cancer. So that's how it will be the application of PICO criteria in the in the observational studies. And I agree with Zia, as he said that we need more examples. So I do have a number of examples over here. I will quickly, but those examples work much better when we are talking in an interactive session, when we are face to face, or if we divide people into groups. So what I will do right now, let me pause for a minute and see if there are any other before I decide whether we have almost 8 minutes. So let me see if there are any questions or not. Yeah, this is a very good this is a very good question. Alia is asking, kindly suggest or share basic reading material for beginners. Uh, I think you need to understand concepts first of all. Whenever you were, I always, when I was teaching to undergraduate in a medical college in Pakistan, I referred to CDC's beginner's guide on epidemiology, or there's a book. If you can go to the CDC website, I do not exactly remember the name of that book, but you Google Introduction to Epidemiology or something like that by CDC. You will. It's a free book which is available online, and it's also available. The different chapters are available in the form of links, so you can go through that. I will highly recommend you people, if you are actually interested, to go through that. And because I found that extremely useful when I was teaching to medical students. Uh, so as there are no comments, there are a couple of examples which I have, which will try to explain it. But as I told you people, if you are interested in learning more about this topic, I request you people to understand my subsequent session on study design, which will do two things, which will connect these concepts to study design, and second is it will explain these concepts step by step by giving multiple examples. So the first example is for preschool children with mild to moderate visual acuity impairment. Are glasses and patching effective in improving visual acuity compared with glasses alone or no treatment? So I will ask you people, I will pause it over here, and it is in front of you people, those of you who are alive. So what is the population, what is the intervention, what is the comparison group in this statement, and what is the outcome? Please write in the comments. So I'm going to repeat. There is a statement in front of you people. I request you people, and don't shy if you're wrong, okay? That's okay. I mean, it's just a learning process. So I will want you people, so write in the comments that what is the population, what is the intervention, what is the comparison group, and what is the outcome in this statement. I am assuming that there is a lag in the video as well, so I have to wait a bit. Uh, but I'll just want you people to comment in the comments that in this particular, I just want to understand that whether you uh, got a bit idea about the concept or not, that what is the intervention, what is the population, what is the intervention, what is the comparison group, and what is the outcome in this statement. And we will have to wait for a few seconds to listen from yeah, some comments are coming now, are beginning to come. I will request all of you people to please comment on this particular point. It's very important that you understand this. Okay. So Sakina is saying that population is preschool children. Now, here it becomes very deceptively tricky. As you can see that, what is the statement saying? You are nearly correct, but not precisely correct. The population is, and as I'm describing the population, I will request you people to write about the intervention, comparison group, and outcome as well. So the population is preschool children with mild to moderate visual acuity impairment. When you're saying only preschool children, then you are not talking about any visual acuity impairment. Okay, so the population here is people with mild to moderate visual acuity, children with mild to moderate visual acuity impairment. Okay. So okay, let me read some other comments. Yeah, exactly. So Alia has come up with the with the precise explanation of the that preschool children with mild to moderate visual acuity uh, is equal to population. What is an intervention over here? So because we are almost to the end of our session, I will just say it, and those of you who want to write in between can also write in the comments. But intervention over here is what it is saying. This is the population for uh, preschool children with mild to moderate visual acuity impairment. This is the population. Now, what are we testing? Our glasses and patching. Okay, so the intervention is glasses combined with patching. This is the intervention. And okay, some more comments. And yeah, exactly. Alia has come up with the correct explanation about. Uh, that's encouraging for me, so that I'm you people are following me to some extent. So intervention is glassing effect. What is the comparison group? What is the comparison group? So in the interest of time, I will say the comparison group is compared with glasses alone or no treatment. That is the comparison group. Okay, and what is the outcome? Outcome has as just a minute compared. So Alia has said it correctly once again, that comparison group is no treatment with glasses alone or no treatment. It is glasses alone or no treatment. Okay, and what is the outcome? Yeah, Zia has correctly said that improving visual acuity, that is the outcome. So that's one exercise, and we do it quite frequently when we are uh, 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 when we do this exercise, and you are able to uh, apply pico criteria to multiple research questions, and you will be able to do that. So with this, I think we are end of this session. I would request a couple of things from you people. First of all, I will request you people to subscribe to this YouTube channel and click the bell icon, because I am uploading a number of videos which are research related. These concepts will be also uploaded regularly on the regular basis in the form of small videos, where you will be able to understand these concepts in a bit more detail. So please subscribe to this channel. Second is that we will have a follow-up session on study design, and this is going to be a series of sessions where we will be building on the previous uh, concepts. So please attend those sessions. And with this, I will thank all of those who have been attending this session live, and I will also thank those who will be attending the recording of this session. And with this, I will hand over the stage to Mariam Zara to conclude this session. Thanks a lot.
Thank you, Dr. Amir. Thank you, everyone, for attending this session. We hope that you found this session informative and valuable. I would like Dr. Danial to end this session with Dua Imam Zaman alayhi salam.
I think,
Is Dr. Danial here?
yeah, but yes, yes.
Okay. Dr. Daniel, please end the session with Dua Imam Imamia, please. So with
Allahumma.
that, Allahumma salli ala Muhammad wa ala Muhammad. So with that, we will end this session and take care, everyone. Allah Hafiz.
Allah Hafiz. Thank you very much. Allah Hafiz.
Thank you. Allah Hafiz.